This video is part of a quality improvement project to reduce the incidence of abusive head trauma in infants, also called shaken baby syndrome, in conjunction with the Period of Purple Crying education program. I'm going to talk about 3 main points. 1, what is the period of purple crying? 2, how it is currently being used. And 3, how can you help? Period of purple crying is a new way to describe a normal part of infant development when babies seem to cry inconsolably. The term colic has been used in the past, but it's recommended to avoid this verbiage as it sounds like an illness and can imply that something's wrong with the baby when they are actually going through a normal phase of development. The acronym PURPLE is used to describe this phase. P stands for peak of crying. Babies may cry more each week, the most in 2 months, at 2 months of age, and then less in months 3 and 4. U stands for unexpected. Crying can come and go without a specific trigger. R stands for resists soothing. Babies may not stop crying no matter what parents do. P stands for pain-like face. A crying baby may look like they are in pain even when they are not. L stands for long-lasting. Crying can last as much as 5 hours a day or more. E stands for evening. Babies may cry more in the late afternoon and evening. The word period in period of purple crying reminds parents that crying has a beginning and an end. Excessive crying can cause a lot of stress to parents. This initiative helps parents recognize and cope with crying when it is normal, and with the goal of preventing frustration that might lead to shaking the baby. There's a great informational video about period of purple crying and the risks of shaking a baby. All parents of babies born here at Baylor Scott & White are required to watch that video before leaving the newborn nursery or NICU. This initiative is based on a study that has 3 doses of education, the first being that video, and the second being reinforcing the information from the video in the weeks to months afterward. That's where you come in. Babies see their provider for checkups at 2 days, 2 weeks, 1 month, 2 months, and so on. I know that there is information provided in the after visit summary for parents about the risks of shaking a baby and not to do it. The goal of this project is to add intentional education during the visit. I know what you're thinking. There's not a lot of time in the visit to do a lot of teaching. So here are some ways that you can add it in quickly and efficiently. Number 1, they've already seen the video, so saying something as simple as, "Hey, do you remember that video you watched in the hospital on the iPad? Do you have any questions about it?" 2, if crying or frustration is an issue that they bring up, you can remind them that it is a period of development that will improve with time. 3, last and my favorite, asking if they have a plan for when they feel overwhelmed with the baby. If not, mention a few options like having a friend or family member watch the baby. And if that's not feasible, then remind them that it's okay to put the baby in a safe place like a crib or bassinet that is empty and flat, and leave them there for a few minutes so they can have a break from the crying. I might follow this up by saying something like, the reason I mention this is sometimes parents get so frustrated that they might shake their baby, which can cause severe brain damage. So I just want to make sure every parent has a plan to keep their baby safe. In summary, the period of purple crying describes a period of normal infant crying, and parents can get very frustrated with it. I'm trying to prevent the frustration leading to shaken baby. Parents are watching the video in the nursery and NICU already, and I want you to reinforce the concepts at their well checkups and encourage parents to have a plan for when they feel overwhelmed with their baby.